everybody. It is so good to be with you guys on this awesome Wednesday. We are talking three of the most common dementia caregiver mistakes, as well as chatting about our upcoming workshop on Zoom next week called How to Stop the Four Most Common Challenging Dementia Behaviors. So good to have you. If you don't already know, I'm Krista. I run Dementia Success Path, and what we do here at Dementia Success Path is talk about how we can help with challenging dementia behaviors. I hope you guys are having a great day and welcome, welcome. If you haven't already, be sure to put your name and where you're streaming, whether you're watching live or whether you are watching the replay afterwards. All right. So, with all that being said, uh, just so we know as well before we really get going, if you would like to sign up for our workshop next week, going from September 17th through the 19th on Zoom, the sign up can be most easily found at dementiasuccesspath.com. Dementiasuccesspath.com. I'm also going to be pinning a link to sign up in the chat. Hi, Teresa. Welcome. All right. So, the first most common mistake that a lot of caregivers will make when they're first starting out their journey is that they aren't proactive about setting up their support system. Tell me in chat or tell me in the comments if when we first got our person's diagnosis, or maybe when we first started being a professional, if we're a professional caregiver, like I was, that you assumed you had to learn slash do everything on your own. Because the truth is, this journey, it takes a lot of different parts. The reason why there is no definitive expert on dementia, like why there's not like one person to rule them all, and I'd say Teepa Snow's the only one that comes close to that, is that you have to stop by so many professionals along the way: neurologists, social workers, lawyers, uh, just other types of doctors. It takes so many types of folks. So ideally, what you want to do is, while it's easy, especially when they're in the early stages of dementia, to think, ah, you know, they're fine. Like, I don't necessarily have to ask for any support or any help or things of that nature. That is the perfect time to start building your support network. Start building your team right at the beginning. Or if you're not at the very beginning, you know what? There's no better time than right now to get that going. And what do I mean by support system? What do I mean by that? Sometimes you got to get a little creative, because especially here in the States, it is extraordinarily hard to get anything that isn't paid help. And welcome. Thanks for those who are chatting. All right. Uh, it is extraordinarily difficult to do that. And you can do it in creative ways. So I see some folks in the chat who are saying they're healthcare professionals. Thank you so much for joining me live. Um, Honestly, it could be really, really hard uh, to uh, to think, okay, well, how can I find that support? So, as far as a healthcare professional standpoint, maybe it's sharing tips and tricks with other colleagues. Maybe it's going out there, kind of like you guys are now, and getting some resources. But as a family caregiver, it could look like maybe talking to the local church or a local senior center, and just finding people who maybe you're looking for some volunteer opportunities. Maybe call up some friends and family who maybe may not live close by to you, but who would be willing to maybe do some paperwork for you or make some calls. At the end of the day, getting that support and realizing that you are not alone on this journey is so important. That's also what I love about the workshop that we're doing starting next week, September 17th through the 19th on Zoom. Go to dementiasuccesspath.com if you haven't already, in order to sign up. But it is it is so important to have a community of folks. In our workshop next week, there are hundreds of caregivers, hundreds. God, even the last time on day one, we maxed out the Zoom, which was crazy. That was like over 1,000 people that are all in this situation. They're all dealing with challenging dementia behaviors. Uh, so it can feel very heartening to have just a big collective group of folks that just get it. Oh man. Yeah, tell me in chat if you guys agree that it's just so helpful to just find your people, find your tribe of folks that will go along with you on this journey, as well as getting creative about who can help you. Because at the end of the day, it's just unfortunate that, the longer you're in the profession, if you're a professional caregiver, it's easy for you to get burnt out and feel like no one understands what you're going through, as well as it's especially easy for family caregivers to feel like as they go through it, the caregiving tasks get like more and more involved. It's almost like watching someone go through the developmental stages that you watch a kid go through, but in reverse. So while like in the beginning, it's definitely a lot more emotionally taxing, towards the end, it becomes very physically taxing. So it's very, very important to build up that network of folks to support you and do it early versus, get towards the middle or the end and feel completely overwhelmed. And it's the same thing with professional caregivers. It's so, so good to build up that network of other colleagues who uh, can really empathize with you and support you. I remember as a professional myself, I felt very isolated during the pandemic because I only saw my clients and I saw my then boyfriend, and that was it. It's very easy to feel like no one gets it. No one understands. All right. Oh, thank you, Kristen. She says, yes, it takes a village. Uh, let's see. Maria says, my dad and I would like to get help financially to help us taking care of mom. I was wondering if anybody could help me with that. Yeah. Yeah, that's a great question, Maria. So that is definitely something else you definitely want to get done on the front end as a family caregiver for sure, which is definitely my suggestion would be if there's even if money is tight, even if your family or your loved one has very little money, if there's any type of money to spend, spend it on that lawyer because they can really help you make sure that you are all set up for getting Medicaid if they have little to no money, or if they do have assets, the earlier you can get like a living trust set up, the easier it is for you to have more options as far as Medicaid or just really understanding the system. Um, let's see. ICOS Green says, is sundowning something to expect daily? Um, it depends. So I know we've talked about this before, and you guys tell me in chat or in the comments if you guys know this. So dementia is an umbrella term. So there is dementia itself is not a disease. It's like a category, kind of like cancer is a category of a bunch of different types of diseases that do similar things. So Alzheimer's is by far and away the most common type of dementia. So sundowning is very, very common for sure in Alzheimer's. And it could be less common in some of the others, like frontotemporal dementia or in Lewy body dementia. It can be a little bit less common, but it can happen. Sundowning itself is not a disease as well. That's something to keep in mind too. Sundowning is a way to describe the uh, basically the brain getting tired as the day goes on and the increase of symptoms as the day goes on. So more agitation, more anxiety is what you see the most often. However, sundowning can look like however your person experiences dementia, just getting more intense. And it's individual for each person how they specifically experience dementia, but they're definitely in the workshop that we're doing next week on Zoom. And again, if you haven't already signed up for that, you can go to dementiasuccesspath.com to sign up. Um, oh, thank you, Amira. Anyways, it absolutely, it absolutely could just be really, really hard uh, to really pin that down. So, anyways, all right. Let's see. Okay. So, thank you for the questions. If you guys still have more questions, feel free to put it in chat or put it in the comments. I'm happy to get to it. Uh, again, in the workshop as well next week in how to stop the four most common challenging behaviors. We're going to be going over things like sundowning, like accusations, like refusals, because while again, every single person with dementia is going to react to it differently, it there are some common themes. There are some like common categories that you can put it in. Like while like your person's agitation may look different than this other person's agitation, agitation can still be a pretty common occurrence. So it's good to have some strategies in your back pocket, some practical things that you can try. If you've ever watched any of my short skit videos, that's a lot like what the live one's going to be. It's almost like watching a skit, like a video live, essentially, and being able to ask questions about it live, get clarification, things of that nature. Uh, Tell me in chat if you've ever heard somebody say, like, oh, just redirect them. And you're like, I don't really know what that means. That's why I love demonstration. That's why I love the skit videos, because instead of me trying to explain it to you, I show you instead. It's, at least in my opinion, it's a lot more effective. A lot of us are more visual learners. Um, let's see. Yeah, so this stream is about the three most common caregiver mistakes, and we're talking a little bit about the workshop next week as well. We just went over mistake number one, which is trying to go caregiving alone, whether you're a family caregiver or a professional. It's very easy as a professional to get burned out and isolated in what you're doing. Maybe sometimes finding community as a professional could look like maybe going to educational conferences or just really being around folks that understand your day to day, because even though it is different and that you can go home as a professional caregiver, it still is really taxing on your emotions. It's really taxing. One of the best pieces of advice one of my colleagues gave me when I initially started doing professional caregiving is to make sure I had a really safe space of people that really get it. And that helped a lot. Yeah, you guys can ask whatever questions you want. Absolutely. Yeah, yeah, Kristen, that's great. She says, yes, it's hard to just hear to redirect them without any context behind that, especially if what you're currently trying isn't working. Yeah. So, real quick about redirection, if you guys are curious about that before we move on to mistake number two, is that okay? Is that you want to address your person with dementia's concern first before you try to get their attention on something else, aka redirect them. And the reason why that's important is because it, our folks are easily distractible, but they're not as easily distractible as you would think. So it helps a lot more to make sure to really listen to them, to really understand what their current belief system is in that moment, and then direct their attention onto something else. Also, just understanding what they believe in that current moment will help you figure out what is the thing that's going to work the best to redirect their attention on. So, uh, all right. Okay. So, second most common mistake is that we don't necessarily know exactly what to say or exactly what to do. And I know we've just been talking about how every single person with dementia is different. You're just like, uh, well, how do we do that? And the answer to that is similar to what I was literally just talking about, which is you want to get curious. You want to get curious about what your person with dementia's current experience is. And you guys can tell me in chat as well. What they believe can change from moment to moment. They could think mom is alive, they could believe mom is passed, and they could believe mom is resurrected from the dead again by that evening. It could be really, really hard to keep up, which is why I'm not a huge fan of saying, like, hey, say absolutely this in every single situation is going to work. Truly, what's there, your true North Star when it comes to understanding your person with dementia is asking them simple questions. So asking them, like if they're saying, "Hey, I want to go home," ask them, "Hey, so what's at home? What are you looking for at home?" That way, you're getting a better sense of their world and what's going on, and it's a lot easier for you to then help meet their needs, meet them where they're at. I hear the meet them where they're at type phrase a lot, but generally that's what they mean is get curious. Don't be so quick to try to get to the solution because at the end of the day, you're ironically going to find the solution or the answer to why your person's upset or how to calm them down or how to get their attention onto something else a lot faster by just being a little bit patient. And I know we hear a patience thing a lot, but very much what that means is you are asking them some simple questions, or you're maybe taking a little bit of time, like 5, 10 minutes, to take them outside if they're really, really upset, waiting until they calm down a little bit so they actually can listen to what you're saying. Because if they're screaming, hollering, banging on the door, they're not listening to you. They're not listening to a word you're saying. And that's the truth. All right. Okay. All right. Hi, everybody. Oh, good, good. Okay. Alrighty. So that's the second thing is you want to get curious about what your person with dementia is talking about, what they're needing. Don't be so quick to get to that solution. All right. I'll go through the comments a little bit and see if I've missed any questions. Okay. Okay. I have a few people talking about how their person is getting confused about, let's see, confused about people in their life. Yeah. So, another big thing that I hear a lot of people mention as well is that they are nervous about lying to their person with dementia. You guys tell me in chat or in the comments if you felt just a little guilty about trying to tell those therapeutic lies or not being 100% honest with them. To be frank, I don't think of it as lying. Because the thing is, even if you tell the absolute objective truth to your person with dementia, they could still perceive that as a lie. So truly there is no way, there would be no way to win. So what you want to do instead is think of it as you're just being consistent with what they already believe. So again, your goal is to understand what it is that they believe in that moment and then be as consistent with that as you possibly can. Now that's easier said than done. Sometimes your person with dementia believes that the person they're asking for is alive when they've passed. So getting a sense of what they actually believe is going to really help you. So if they say something along the lines of, "Oh, I feel like no one's telling me the truth. Can you just tell me if something is wrong with so and so?" Then that could lead you to believe that they already have a sense that it's within the realm of possibility that that person could have passed. So it's okay to tell them, yeah, you're right. Your instincts about this are correct. They have passed. So if they're asking you more directly, it's okay. It is totally okay to say something along those lines, versus like if they're like, oh yeah, I saw my mom yesterday, even though mom's been gone for like 20 years, then it's it's okay to say something consistently to stay with what they're saying. I'd say better yet, ask them a few more questions. Like honestly, get them to answer their own question. So what I mean by that is if she says, "Oh, have you seen mom?" It's like, I haven't. When was the last time you saw mom?" And she responds with, "Oh, I saw mom yesterday. I'm just worried about her." It's like, "Oh, what do you think mom would be doing right now?" I think she's probably at home or, maybe at church or something like that. You're probably right. Why don't we give her a few hours before we just start worrying? Here, let's go do, the puzzle over here. There you go. So you address the concern first. Where's mom? Then you did the redirection. Both are equally important, you can't really have one without the other, truly. Jalen says, "This is wonderful. What are some techniques to cope with repetitive routine? I can only imagine the patience required of a caregiver." So I'm not 100% sure what you mean by repetitive routine, because routines are really helpful to our folks with dementia. So I need a little bit more context there. But uh, yeah, absolutely. It's definitely in our, as we were talking about before, and if you were just joining us, we're having a workshop next week called How to Stop the Four Most Common Challenging Dementia Behaviors on Zoom. You can go to dementiasuccesspath.com to sign up. I'll also have the link on the replay pinned to the top. So that's something we could have um, as well. So we're going to be covering a lot of that. Okay. All right. Oh, that's a good question, Elise. What if they always try to come along when you're leaving the retirement home? Yeah, that's a great question. So there's a long-term answer and a short-term answer to that. So a short-term answer to that would be give them a reason that would make sense within the context of what they currently believe. So if they absolutely believe 100% that they should not be there, uh, that they need to go home or what have you, you want to give them a reason like why they would need to stay. Just like, oh, we tried moving you here to see if it would work out better. It seems like it's not working out for you, so we can't move you out today. You got to pack the boxes and do all the things. So you got to stay here at least for right now, and we'll figure it out tomorrow. Yeah, again, just give them a reason why not right now. That would make the most sense to them. That would really, really help. A long term, so that'd be a short term solution. A long term solution would be making sure that they are more involved and engaged in their community. So it feels more like home. Because I think something that a lot of us don't quite understand as caregivers, whether it be family caregivers or professional caregivers, is that we, uh, is that being at home is more than just us sitting at home. We do things there. We tidy up, we cook things, we being at home is an action. So what ends up happening at long-term care facilities is that they're very concerned about entertaining them and serving them, which feels more like you're at a hotel or you're a guest somewhere. So it can be very confusing for our folks. So maybe encouraging the activities folks to involve that person more in like the setup or the tear down of those things, or maybe ask them to help them set the table. These are all things you can ask the folks that work there to try and see if they can get them more engaged. Usually, professional places like skilled nursing or memory care, things like that, will be happy to accommodate that. All right. Oh, good question, Wheezy. How do you deal with aggressive behavior? How do you diffuse it? It depends on what the aggressive behavior is, truly. So, I guess first and foremost, you absolutely have to be sure that you are safe. As a caregiver, you got to make sure that you are safe. So, what's there is you need to make sure that you're at a striking distance. That's what we used to call it in the professional setting. And you have to be sure to wait until they've calmed down a little bit before you try to ask them questions or try to redirect them. I think that's a big, big mistake a lot of caregivers make is that they try to redirect immediately. And quite frankly, if they're getting to the point where they're being aggressive, again, they're not going to listen to you. So get them calm first, redirect second. Okay. Okay. All right. What do we do if a patient refuses to take medication because of their denial of having dementia? Yeah, that's a great question. Anna, thank you for asking that. So it depends on why they're refusing the medication. So something that I've noticed, and granted, someone else asked if I'm a nurse. I'm not a nurse. I have worked with a lot of nurses, a lot of doctors. I was in the therapy department of a behavioral psych hospital. So that's how I worked with a lot of challenging behaviors of thousands of dementia patients. Um, so what's there to assess first is if you're a family caregiver, let's say, uh, you could figure out, are all the medications that they need to take, is that something that they have to absolutely be on? Is this absolutely something like, do they absolutely have to take all these pills? Because sometimes the reason why they're refusing is there's like 10 pills in front of them, and that can feel really, really overwhelming. If they absolutely have to be on all 10 of those pills, maybe figure out if they have to take all those pills at the same time. That could be something else that can help. Additionally, too, if it's the swallowing of the pills that's really tripping them up, ask your pharmacist or your doctor if those medications are crushable or can be mixed with food. That's very, very important. Do not just try that. Ask that doctor first, uh, because it could affect the medication if that's not okay. Additionally, too, there are some medications that can be given in liquid form as well, so you could ask about that as well. So there's a bunch of different options as far as modifying the medication. Beyond that, if the medication can't be modified, maybe calling them vitamins or taking some meds with them just to visually show them can also be really, really helpful as well. But I think overall, the biggest thing is your person with dementia has to trust you. Uh, taking medication, that's a serious thing. That's something that can affect your health, that can affect how you feel. So, it makes sense why they would be cautious about that. Okay, Max, answer one more question before I get to our third mistake. But thank you guys so much for all the questions in chat. I really appreciate that. And if you guys are watching the replay, you can feel free to ask questions in the comments as well, and I'll go back and answer them. And if you guys want more live demonstrations, if you're fans of the videos that I put out here on YouTube, then definitely come to our workshop next week. We are going from September 17th to the 23rd. Uh, it's called, it's a Zoom workshop, totally for free, called How to Stop the Four Most Common Challenging Behaviors. We do a lot of live demonstrations. We have free cheat sheets and guides just for signing up. And we also offer replays as well. If you can't necessarily come for all the times, it starts at 7:30 p.m. Eastern. So go to dementiasuccesspath.com. So same as this channel name, just add .com at the end of it, and you can sign up there. As well as on this replay, I'm going to have the link for this pinned at the top. Okay. So Max says, I'm CNA on the rehab hall. We have a dementia patient who is hard of hearing and can't see the notes we try to write for care. I don't like her feeling upset with her because her tone, volume, any tips? Yeah, that's actually a really great observation, Mac, in that our body language and our tone of voice really matters with our folks with dementia. They're losing the ability to process a lot of things very easily over time. So, yeah, they're very hyper focused on your body language and your tone of voice to understand what's happening. So, it I what I found is best is maybe come towards, like, not sneak up from them from behind, come kinda to the side. If you come straight on, it can feel kind of aggressive to some folks. So coming to the side, getting down on eye level, maybe talking in a little bit of a lower tone of voice really helps, especially as a female, because oftentimes with hearing loss, they might have a hard time hearing you. It's a surprisingly large amount of people with dementia that also have hearing loss. There have been some studies that have uh, said that there is some connection between rates of dementia and folks who struggle with hearing that didn't use hearing aids or things like that. So that can certainly increase their likelihood of getting dementia. So yeah, those would be my tips. All right. All right. I'll get to some more questions in just a little bit because we got to get to our third most common dementia caregiver mistake. And that third one is that we aren't taking care of ourselves. We are martyring ourselves. What do I mean by that? So it could be so easy to be just like, oh, self-care, self-care, self-care. But it's like, I'm taking care of my person 24/7. Or if you're a professional, you're like, I've listened to this person scream for the last 6 hours. Uh, how do I do that? So there are some very practical ways to do that. So whether you're a professional or you're a family caregiver, sometimes you can just be overstimulated by your person with dementia. And that is valid. So maybe having earplugs, headphones, whatever helps to temper your own senses because ours can get worn down as caregivers as well. That can really help if you're a family caregiver and you're terrified to even get some fresh air. Maybe putting some baby monitors in their room just to make sure that they're safe. There are all kinds of different devices that you can purchase that can help with that. And in our workshop next week, if you sign up at dementiasuccesspath.com, we are giving out free resources with some links to find those items as well. So, again, if you would like more scannable cheat sheets or options to find different things that could be helpful for caregiving, we're giving those away during our workshop as well. We're also going to give out some prizes too on the last day. Uh, it tends to include some books or some things to help with self care. But those are some more practical things. But I think probably the biggest thing as far as taking care of yourself as a caregiver is you want to let go of the guilt. Inevitably, especially if you're a 24/7 family caregiver or you're a professional who was just dealing with it for like 12-hour shifts or 8-hour shifts or however long. If you say something or do something wrong, or you do something that you're like, God, I didn't mean to say that, or God, I didn't mean to do that, you got to forgive yourself because if you keep holding on to that, it's going to eat away at you. If your goal if your goal as a family caregiver is to have them be in your care at home indefinitely, then you're going to burn out a lot faster. If you're a professional who just absolutely loves your career working with folks with dementia, you're going to burn out faster by just not taking care of yourself, by just letting that guilt eat away at you, by letting yourself go home with all the emotions and the guilt from work. As well as I will add too, having boundaries as a caregiver is extremely important as well for taking care of yourself. And what do I mean by that? So you're not going to teach your person with dementia anything new. You're absolutely not. However, if your person with dementia is screaming at you, if they are hurling insults at you, and believe me, I've had someone with dementia scream at me insults for like an entire hour straight. It can, it is absolutely okay to put up a boundary for yourself and say, look, I can't help you when you're upset, when we're upset. So I'm going to go in the other room for 10 minutes and I'll come back when we're both calm. You don't have to make it complicated. You don't have to scold them. You don't have to correct them. None of that has to happen. But it is so important to give yourself that moment of peace in order to continue to be your best self as a caregiver. So, boundaries, setting boundaries for yourself. So, again, not trying to change your person with dementia, specifically setting boundaries for yourself is so important. So, again, the three most common mistakes are one, trying to go it alone, not building up that community, whether you're a professional, whether you are a family caregiver. Two, not getting curious about why your person with dementia is doing what they're doing, just going immediately into problem solving mode and not considering. And third, just not taking care of yourself in more practical ways, letting that guilt eat away at you. These are some of the biggest mistakes I've seen. And if you are willing to ask for help, give yourself grace and just have a little bit of patience in solving a problem, you are going to do so much better as a professional caregiver and as a family caregiver. All right. So, with that being said, I'll continue through some questions before I hop off. Again, if this has been helpful and you'd like to see more demonstration style stuff. So you know exactly what to say, what to do. You're interested in getting free cheat sheets and resources. You're interested in just not feeling alone anymore, of connecting with a bunch of people who are just like you going through caregiving for folks with dementia that some of the symptoms of dementia are them having challenging behaviors like refusals, like accusations, like aggression, like repeating, then it can absolutely help you. Go to dementiasuccesspath.com to sign up. I'll also have a link to sign up in pinned at the top of the comments for the replay of this as well. All right. All right. I'm looking for some questions that I may have missed. Teresa says, what's the best advice you can give as a new EMT who is dealing with a dementia patient for the first time? Discharge from the hospital or an emergency? I have a bunch of EMT students who ask me. Yeah. So I think definitely, I can definitely empathize when it's an emergency situation, you're trying to get something done, but kind of like what I was talking about with mistake number two, it's okay to just take a beat. It's okay to really slowly, with as few simple words as possible, explain what you're doing and maybe have them maybe like buckle a seatbelt to themselves or something like whatever helps them feel more in control, I think is really going to help as far as emergency situations because it's easy for them to feel out of control and scared in emergency situations. So take a breath as EMT folks and make sure to just walk them through stuff slowly. I'd say that'd be my best advice. Okay. Oh, good question. Blue man, blue man vision. What are signs of dementia because I might have that? Oh, okay. So, some early signs of dementia can be uh, you having some forgetfulness that is more intense than like your average forgetfulness. So, a common trope of Alzheimer's could be you leaving your keys in the freezer. So, getting lost in super familiar places, like places you've been to for years. That's a big sign. Just I would say having trouble with doing maybe more complex tasks like paying bills or like maintenance on the house or like things that are a little bit more complex that would have been easy for you to do before. Those are some definite early signs of dementia for sure. Okay. Oh, that's a good question, H. McCain. Do you need to legally tell them you have baby monitors in the room? It depends. So if you're a professional, I would say you probably need to get the clearance of whoever has the POA for the baby monitors. I mean, if it's just like your family member, then no. Especially if it's your house too. Like, no. You can just install it. If you wanna let them know that you have the cameras in their room, then you certainly can, for sure. Okay. Okay. Let's see. Any advice for nurses? JC Superstar 22. These usernames are funny. Uh, yeah. So again, I'd say the main one for nurses would be my second point, which is oftentimes what escalates situations really hardcore with our folks with dementia is just trying to rush to a solution. Rush, 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 rush. Uh, get curious about what's going on with them. So let's say you need to do some type of medical procedure, like stick an IV in, draw blood, whatever. Um, just take some time, take a few beats to explain to them what's going to happen and maybe have them hold on to something or get them involved in whatever it is that you can so that they feel like they have more control. yeah, just trying to get a sense of what they believe is happening first can really help as well. Like, I've had some people be super disoriented that they didn't even realize they're at the hospital. So something I will ask is, "Hey, do you know where you are right now?" And if they say no, I'll be like, "Oh, well, yeah, have you ever been to a hospital before?" They say, "Oh, yeah." It's like, "Yeah, so you're at a hospital right now, and that's okay. You're not gonna be here forever, but you are at a hospital right now." Definitely them hearing that they're not gonna be there forever also really helps as well. Even if you know they're gonna be there for a while, uh, that can really, really help. If them feeling trapped is a big trigger. Let's see. Okay. All right. I think I've gotten through most of the questions here. So, again, if you guys haven't already and you're interested in learning more strategies to help your folks with dementia to tackle things like the phrase, I want to go home, like them refusing to shower and bathe, like them accusing you of things that you didn't do, and you're a fan of the videos that show you that, it's like a live version of that. You want some cheat sheets and you just want to connect with hundreds of other caregivers that are just like you, then definitely come to our workshop, How to Stop the Four Most Common Challenging Dementia Behaviors on Zoom. You can sign up for it and get that Zoom link on dementiasuccesspath.com. So, absolutely come on down. We'd love to have you. And hopefully, I will see you guys very soon. All right. Bye, guys.